I think that in the discussion of hormones, we have to be really careful because I think there also can be a lot of demonizing of natural versus synthetic. And I think that the words can be thrown around and not intentionally wanting anything malicious or any confusion. Arguably, there is a lot of confusion, and that comes down with the words natural versus synthetic, bioidentical versus synthetic, compounded versus FDA approved. And this is where I kind of get rattled because females' health is scary enough, confusing enough. And then when we extrapolate a sentence and we make it a statement, we have to be very careful it's a correct statement, or it can really be very misleading when you have so many things. And you actually made a really good point when you said, I enunciated this. I hope you hear the enunciation in this word. So if we go back to just the word progesterone doesn't really tell us enough any longer. So progesterone could be what's produced by the ovaries, what we're producing naturally in our body, or at this point in time, we can also be talking about actual hormone therapy. And this is where words like bioidentical progesterone come into play. And some providers will argue there's no such thing as bioidentical. That's just gibberish. There's no medical term. And you know what? Arguably, they are right. However, for the sake of a dialogue and the sake of a conversation, there has to be some sort of delineation between what we're talking about. Otherwise, it gets very confusing.